Another show on neck pain and back pain, disc problems, arthritis, inflammation, and alternative and conservative solutions. That's what we're going to talk about here. Wow, that's a lot, right? So let's dig in. Most low back pain, lumbar spine, is caused from irritated discs. Irritated discs. That's a common diagnosis that I will give people. Before x-rays, before MRI, I will say, very likely your problem is irritated discs. Can be other things, but that's usually what it is. Now notice I pick my words carefully. Irritated discs, okay? As we get into this, I always have to say our medical disclaimer. I am not giving you medical advice. Don't do anything that I suggest here without consulting with your doctor first. We are not forming a doctor-patient relationship on this show or on this video. If you have any questions whatsoever, talk to your doctor first, and never change or take or not take medications and so forth until you talk to the doctor that prescribed those things or your healthcare practitioner, okay? All right, so disc irritation is a common diagnosis I'll give to people with back pain. And in the neck, it's slightly different. In the neck, I'll say disc and joint irritation, okay? So that's the cause of most pain. Notice I didn't say it's a muscle problem. Now, some people will come in and they're like this, and they can't move. We call it the question mark, right? Their muscles are in spasm, and oftentimes they're given a diagnosis of muscle spasm. The muscle spasm is not the cause of pain. It's not the cause of a problem. Muscles in this situation, in almost every case, are not spasming because they feel like it or spasming because they're damaged. They are spasming because the irritated discs in the lower back have said, I'm irritated and I'm hurting. Please protect me. And then wham, our body does this because they're contracted on one side, okay? So that's what's going on. The irritated discs through the nerve network right here locally are telling the muscles, clamp down, don't let me move because you might irritate worse. You see? Okay. So now some people will say, well, then I take a muscle relaxer and I feel better. Oh, okay, fair enough. But again, the muscles weren't the primary cause of the problem, okay? Now, muscle problems tend to go away very quickly. If we go to the gym and we pump iron, we get sore, 2 days later, it's gone until we work out again. Follow? And what I tell people is the muscle soreness post-workout is quite a bit different than the pain you're having, and most of them say, yeah, that's true. I don't get this kind of pain at the gym, in muscle soreness from a gym workout or something. Okay, so we know it's not muscles. Are the muscles involved? You bet. Are they the primary source of pain? Nope. Let's get into that. I'm going to just give you a couple of things. This first article I'm going to read to you briefly is now 30 years old, and this is such a good one. The Tissue Origin of Low Back Pain and Leg Pain, a report of the pain response to stimulation during operations. Now they're doing operations, catch this, on the lower back using local anesthesia. The primary author here was Kuzlich, Dr. Kuzlich. The journal was Orthopedic Clinics of North America in April of 1991, so 30 years ago, okay? The authors note they performed 700 lumbar spine operations, local anesthesia. Let me tell you what they found, because I know the study very well. They goosed the skin and said, does that hurt? Patient says, yeah. Is it reproducing the pain that you're having? Nope, not at all. They anesthetized that and exposed muscle. Goosed the muscle. Does that hurt? Yes. Is it reproducing your symptoms? Nope. And they go deeper and deeper and deeper. It's not until they got to the discs, when they goosed the discs and they said, does that hurt? And the person says, yeah, that hurts a lot. Is it reproducing the symptoms that you're having? Yeah, definitely. So when they found the offending disc and goosed it, it would generate the person's back pain if they were having local back pain all the time. If they were having leg pain, they had to tug on the nerve root, called in some cases sciatica, but that's not truly the case in all leg pain. But posterior leg pain can be caused by sciatica. So when they goose the offending disc, it doesn't cause leg pain. But when they goose the disc, when they stimulated it, when they poked at it, it caused a reproduction of low back pain, 700 operations, 700 volunteers. Would you like to volunteer for that? Here's an article I pulled up today. American Journal of Neuroradiology 2015. The title, Systemic Literature Review. So a literature review, they're looking at a bunch of studies of imaging features of spinal degeneration in asymptomatic populations. So what they're saying is we're going to study a bunch of people, don't have back pain, see what comes up on fancy tests. Degenerative changes, arthritis, are commonly found in spine imaging but occur in pain-free individuals as well as those with back pain. So you might see arthritis, disc degeneration, disc herniations, disc bulges, disc prolapse, slip disc, all this kind of, discs don't slip by the way, but irritated discs and so forth on MRI and X-ray on somebody with pain but also somebody without pain. We performed a systematic review of articles reporting the prevalence of imaging findings, CT or MR, so CAT scan or MR, in asymptomatic individuals. They had 33 articles that they reviewed in 3,100 asymptomatic individuals. And they found that disc degeneration, arthritis, increased from 30% to 37% of the 20-year-old individuals. 37% of 20-year-olds have disc degeneration. 1/3 of 20-year-olds is what they found with no pain. Up to 96% of 80-year-olds. So when you reach 80, 96% of you will have disc deterioration, degeneration, okay? And then they got into disc bulges and disc protrusions and annular fissures and breakdown of discs, basically, okay? Conclusions, imaging findings of spine degeneration and wear and tear, my words, wear and tear, are present in high proportions of asymptomatic individuals, meaning there's no pain, but you've got some wear and tear going on, increasing with age. Many imaging-based degenerative findings are likely part of the normal aging unassociated with pain. Did you get that? Okay. Here's what I talk about in my office to explain it to people. This has happened thousands of times when somebody comes in with back pain. So somebody comes in with low back pain, number one human complaint, anywhere in the human body, any complaint that somebody has, the number one frequent thing is low back pain. Low back pain is almost always caused by irritated discs, okay? Irritated discs are the number one cause, and that's why I use my words, disc irritation. Here's why I say that, because you can have no disc problem seen on imaging and still have disc pain. I'll give you an example. A man in his 30s came in to see me. He had low back pain for several years. I'm working on him. He's getting better, but he's not all the way better yet. His primary care physician ordered an MRI, and I told him, you know, I'm going to predict your MRI findings, and they're going to be normal. In other words, I told him, I don't think you need an MRI. Okay? Sure enough, the MRI report comes back, normal study. Now, I still gave him the diagnosis of disc irritation, but that was not seen on MRI or X-ray. Okay? So here's the deal. I'm going to use my little model here. So if we look at the lower back and we take a couple of segments here, and we've got a disc right here. I'm going to show you that unit on close-up. So you've got a bone, hard bone, softer disc, although the disc is pretty tough, and then a bone in between, okay? So that's what you have here. Now the disc is cartilage, like cartilage in a knee, but it can break down over time. So what happens with some people is the disc will start breaking down, but you won't see that on MRI, you won't see that on X-ray, and it is enough to start causing pain. That's what happened in this man with beautiful looking discs on MRI, but they're still irritated. It's kind of like somebody with a sprained ankle. Have X-rays, no fracture. MRI, nothing seen, although we know that the ligaments and tendons and muscles are torn. They're not torn in a big enough tear to see on MRI. You follow? Well, same thing here with the disc in this young man is his discs look fine, although they're irritated. I would imagine if I goosed his irritated disc with a big needle, he'd say, oh yeah, that hurts a lot, that's my disc problem. As the disc breaks down, it may bulge or herniate. I'll show you here. It may bulge or herniate like this, almost like the jelly donut is coming outside of the donut. The jelly in the center is coming outside. Okay? That's a disc bulge or a disc herniation or protrusion. It may or may not hit a nerve. Some people can have local back pain, no leg pain. Some people can have back pain and leg pain, just like the new man that I saw today, unfortunately, he has that. Or we can have leg pain and no low back pain from this disc bulge or herniation or prolapse, okay? I also want you to think of a disc. An easy way to wrap your head around this is a disc is like a tire on your car. When the car is brand new and the tires are brand new, all the discs look beautiful, okay? Nice thick rubber on the tire, or in this case, the disc space is nice and thick, okay? There's not a lot of space there, so the disc is nice and thick. There's a lot of space, there's not a lot of wear and tear or thinning of the discs, okay? Same with those new car tires. But if you have a brand new car and the front end's out of alignment, nobody caught that, you drive 10,000 miles, you bring it in for a tune-up, they say, hey, one of your tires is wearing down. Like, really? I had no idea. I had no idea my spine, my front end of my car was out of alignment. Do you see? If the front end of the car is out of alignment, it's going to wear down on one of the tires, maybe one of the discs in this case. It's going to start wearing down prematurely in that situation, right? In the early phases, the first 10,000 miles of driving the car on a misaligned front end, it's not making any noise. It's not shaking down the highway. It's not squealing when you're going around turns. There's no vibration. There's no symptoms of that misalignment. There's no symptoms of that, okay? We might start to detect wear and tear, or you come in for a spinal check and we see that your spine is like this, or maybe we snap an x-ray and we see that you have too much curve in your lower back or not enough. We're starting to see misalignments in your spine, but it's not causing any noise yet. You're not squealing when you go around the corner. You can do all activities in your life without any symptoms, you see? It's not until this breakdown of the discs occurs over time, just like driving the car on a misaligned front end and not catching that early. That's what tends to happen here, and then things start to wear down, okay? Now, you don't even have to have a misalignment this much, like let's say that this is a scoliosis from front to back. You don't even have to have a misalignment that much. Maybe it's a little bit off. But then we do things millions of times in our lives, just like we put lots of miles on the car, and things start to break down. Or when we look at the spine from the side, somebody has too much or too little curve. These are things that we evaluate for in my office, okay? So that's a little bit of what's causing pain. Now in the neck, it's a little bit different. In the neck, you can have irritated discs causing pain. You can also have irritated joints. They're called the facet joints. These facet joints are like knuckles. They allow us to move. They're like knuckles, okay? Those are the joints here. Those joints can get irritated, and they can also cause some neck pain, these joints back in here, okay? You've got a lot of these joints. They're only as big as the knuckles on the ends of your fingers. So you imagine this little tiny neck structures right here, the little tiny neck structures are holding up the big heavy head all day long, and if we're holding it in a bad position all day long, like this, okay, it's like you holding a weight out here, trying to hold up 10 or 12 or 15 pounds like that all day long. Ugh, that shoulder is going to take the wear and tear, or in this case, the neck takes the wear and tear. That's the problem with text neck, okay? So we have a variety of things happening here. We might have a misaligned spine, We might have a job that requires us in a bad position for a long period of time, whether it's a sit-down job in front of a computer, or it's a laborious job where you're lifting heavy things all the time and causing repetitive sprains and strains in the lower back. And the man I'm thinking about today, in his late 50s, he had an attack of a snowblower incident. Snowblower got clogged, and then it lurched and it sprained his back, irritated his joints. Then later on, he had a large lawnmower lurch away from him and yank him again. I had a woman recently who got the dog pull. That's another thing that happens. The dog takes off and yank, and then sometimes you can get injured up here. In this case, she got injured down here. And on it goes. The slip and the fall, the shoveling the snow, the raking the yard all at once, cleaning out the attic. It just goes on and on and on. And I've got, obviously on this show, I've done hundreds of shows on these ergonomic things as well. But that breaks down the tissues in your neck and your back, the discs and the joints. And this breakdown happens over time. The breakdown of the discs and the breakdown of the joints and the breakdown of the joints here happens slowly over time. And that's why it might not have pain right away. It might happen slowly over time. And oftentimes the last thing to show up is pain, okay, on that wear and tear process, okay? So bringing you back around to where we are now is a lot of the diagnoses that I give in people's backs is irritated discs. And then in the neck, I'll tell them you have irritated discs and irritated joints. Simple, okay? That's what's going on. And then we get into treatments, okay? Now, a couple of things is if you have serious leg pain and or arm pain and you feel like it's a blowtorch of pain down the arm or down the leg, okay? Worst pain you've ever had, staying up at night, whatever, can't sleep, you go to an ER. You get checked out by professionals to make sure that you don't have a disc herniation that I was showing you earlier on the model, this disc herniation here that can be causing a nerve root compression on that nerve, okay? And if it's sitting on that nerve and then you've got blowtorch pain down your leg, sometimes you need to go in there and take that herniation off surgically, or you will lose the function of that nerve permanently. Sometimes that herniation can go inward and hit the spinal cord and cause cord compression. So if you lose bowel or bladder function, that is an emergency room situation. Just keep that in mind. It can also happen from your neck. If the neck spinal cord gets compressed, you can have a variety of systemic things, even down below, that can actually be caused by your neck. Do you follow? So those could be surgical situations, emergency room situations. Okay, so just kind of keep that in mind, all right? Let's say you're not in that kind of a situation and you end up in my office. So we do our evaluation. We're trained to do spinal evaluations, orthopedic tests, neurological tests, and so forth. Luckily, in this man that I was talking about today, who's new to me, is when I did his neurological tests, a little thing's a little off, a little sensation is off, a little vibratory sense. We do those little pinwheel things. We test the reflexes. We test muscle strength. Mostly things are intact. He had already had an MRI before he came into my office. He already had x-rays before coming into my office. So I already had that information. So we knew it wasn't a surgical emergency. And from his recent flare-up, he was already improving. Thank goodness for that. So we're going to push forward with care, and he's also going to physical therapy. So that's going to work out. All right. We have a laundry list of things that we can do in my office. Now, if you're new to chiropractic, just keep in mind that chiropractic is not just the manual adjustment or manipulation of the spine that lots of people think of, or the videos that are really popular out on YouTube show people getting twisted and cracked and popped and so forth in all these different directions. That's part of the tools in the toolbox, but that's a small tool in my toolbox. I do that on some people, but lots of people never get that treatment when they come into my office. So as a chiropractor, I have a variety of lower force techniques that we do that I've explained in my office in the past. So I have a light chiropractic instrument that I can use, almost like it's acupuncture, stimulating powerful nerve endings on the surface to shut down the pain pathway deep inside, to start to recondition somebody from a posture like this to a posture like that. That's going to take stress off the discs and the joints, correct? Or if we have a posture like this, we're going to start using that instrument to signal the posture and alignment sensors in your spine and brain to reset that from the old pattern to the new pattern. We have instruments to do that. We have vibration instruments that are going to stimulate blood flow, reduce scar tissue, and stimulate again nerve endings to shut down the pain pathway. I have a low-level laser therapy as it's called. If you want to read more about that or listen to it, I've done it on this show. Go to my YouTube page and go to this website, Erchonia.com, ERCHONIA.com. Erchonia.com, that's the laser that I have. It's a low-level laser. All it is light. Don't even need to touch you. Is it effective? It works a lot on a lot of people. There are 21 FDA clearances for low-level laser on humans. Several of them are for neck and back pain, chronic neck and back pain, musculoskeletal pain, plantar fasciitis, and so forth, okay? Low-level laser. I have a new therapy table. It's called a REACT table, reactinnovations.com, if you want to look at that. It is a bioelectric magnet table. It looks like this table right here. Underneath that is a magnet. It stimulates muscles to contract, nerves to fire, activates brain pathways from the brain back to the area of involvement that we're working on, and it activates metabolism and blood flow. It does it in a way that you cannot do it on your own. This magnet table will contract muscles much deeper than electrical muscle stimulation. So if you've ever had EMS where they put pads on you and you feel the firing of impulses, and you might even get some muscles to move and so forth, it's like that, but on steroids. And there's no pads, and you do it fully clothed. The initial application for this magnet therapy that I'm talking about right now was for pelvic floor rehabilitation for urinary incontinence, okay? So they still build chairs. They have chairs with the magnet underneath. You would sit on it. It would activate the muscles in the pelvic floor like, again, a Kegel exercise on steroids. And many people get improvements in the urinary incontinence, among other things, from this table, from the chair. Now, the same technology is in the table. If you want to learn about how it works for pelvic floor rehabilitation for urinary incontinence, go to the website pelvicwave.com. Pelvicwave.com. I can do pelvic floor rehabilitation on my table in my office. That's another option, something else that we have that is non-invasive and so forth. With laser and with the REACT table, there are contraindications. With laser, can't do it on pregnancy, can't do it on active cancer, and never shine it in the eye, which we don't do, okay? With the REACT table, same thing. Can't do it on pregnancy. You also cannot have an implanted medical device with power, such as a defibrillator or pelvic floor stimulator or a injectable insulin pump. Anything with power you cannot use on this table. Hardware, joint replacements, screws, staples, whatever it might be, that's completely safe on the table. So you can read about those things on these websites on any contraindications, but the list is pretty small, as you can see. Okay, so those are a couple of the types of therapies that we have in the office. But here are two things that are overlooked when we're talking about acute and chronic neck and back pain, disc problems, arthritis, and so forth. And as a side note, the word arthritis is not a diagnosis. If you have back pain and you go to the doctor and you have x-rays and you have an MRI, now I'm talking about degenerative arthritis now, not inflammatory arthritis, degenerative arthritis. And you're told you have arthritis, that's the cause of your pain. Well, I changed that in my office a little bit. I don't give arthritis as a diagnosis. Arthritis is information. Here's why I say that. You can have somebody like the 30-year-old that has back pain, no arthritis, but he still has a disc problem, okay? MRI is completely clean, okay? So arthritis is not causing his pain, and I can show you lots of people, hence these studies here, that have degenerative arthritis, no pain at all. So arthritis doesn't cause pain, degenerative arthritis, in all people. Actually, there's many people where they have arthritis and no pain whatsoever, okay? So it's not a diagnosis, it's information. If you bring the car into me and your car's not starting, and I say your car has arthritis because it has rust and it's older or whatever, that's fine, that's information, but that's not the reason why the car is not starting, okay? There's some other cause of that, and that's why I give people the diagnosis of disc irritation. Okay, so here are the two things that are overlooked, and particularly with chronic neck and back pain. The first one is inflammation, systemic inflammation. Think of inflammation like a fire that's burning in your body all the time, okay? Inflammation is going to cause neurodegeneration, Alzheimer's, heart problems, cancer, the list goes on, degenerative arthritis and so forth. So inflammation is a bad deal, and there's many things that we can do to take care of inflammation. So in my office, we talk a lot about nutrition. Nutrition is a big player. One strike against us is if we live in the United States, we tend to have a higher processed food, not real food diet. It's on the go, loaded with sugar and contaminants and fake additives and so on and so forth, or Roundup and glyphosate tainted food and so on and so forth, right? So we're eating all these inflammatory foods to just crank up the chemical systems of inflammation. So we need to knock that down. Also, if somebody is just overweight, overweight is more pressure on the discs in the spine, particularly in the lower back, just physical pressure, never mind the inflammatory pressure, but physical pressure, and that's going to cause wear and tear. If you take a car that is 3,500 pounds and we add another 4,000 pounds to the car, those car tires are not designed for that. They're going to wear out a little bit more prematurely, okay? So physical weight is some of it, but mainly it's the inflammation that's causing these joints and discs to wear out more quickly, okay? So the nutritional standpoint is something we need to address. And it's something that's not talked about in these chronic degenerative arthritic painful conditions, okay? Then we're talking about low-level dehydration. So we talk about water. I'm asking people all the time, are you drinking enough water? The vast majority of people have said, probably not. So I did a show on water, and I gave people tricks and tactics to make sure we're getting enough hydration in there. We talk about anti-inflammatory supplements in my office. It could be the omega-3 fish oil, vitamin D, B complex, there are many others, turmeric and curcumin, resveratrol, CoQ10, and the alpha-lipoic acid. The list goes on of anti-inflammatory supplements that are effective for some people. Then we talk about spine exercises. We've done that on this show for 25 years. We've talked about spine stretches and exercises. So I have videos that people can go to. They have handouts. We talk about them on visits. Do this, don't do that, modify this. We're always talking about ergonomics, okay? My book, Happy Back. My book, Happy Back, gets into that. The book, Happy Back, is basically a reference material about taking care of your spine on your own. Stretches, activities of daily living, ergonomics around the house, ergonomics at home, how to golf and sweep and shovel and rake, and that's all covered in there. Do this at the gym, don't do this at the gym. That's my book, Happy Back, so look for that. That's another another thing that fights inflammation. Sleep. I did a show on sleep, a 30-minute show on sleep, because it's so important. People tend to be chronically tired and fatigued. That chemical system is not going to be right. The healing processes often will work better with better rest. So we talk about sleep in my office, okay? And the last thing that is really not talked about in particularly acute and chronic neck pain is chronic stress. Not acute stress, chronic stress, that low-level stress that's bubbling all the time, things that we're worrying about that we can't change. We talk a lot about that in my office. I've got videos on that. I've got handouts on that. We're going to talk more about it in future shows for sure. But the chronic stress, how many people will say, yeah, I just had it happen today. We're at the beginning of the week right now, Monday and Tuesday, and people say, I had a stressful weekend, my shoulders were up here, and now this hurts, and I've got headaches and flare-up of migraines and allergies and so forth, or my back is hurting worse because I had to sit and do all this work and things are bothering me. I have a woman that says, my trigger finger comes back when I have a stressful family situation. So we know those stress chemicals we need to really work on reducing that chronic stress as well. So that's a variety of things that we can do to help people with chronic neck and back problems, disc irritation, and joint irritation. I'm Dr. Scott Fuller. Thank you.